Good morning, everyone. So today we're going to continue with the endocrine system with the 6 hormones of the anterior pituitary gland. And these we're going to go through a little faster than the last one. So feel free when you see this recording, just slow it down, press pause when you need. So your anterior pituitary, or the pituitary lobe in the front, secretes these 6 hormones: growth hormone, which we talked about, prolactin, which actually helps produce the milk. So it's pro, positive, lactin, lactation, milk. Okay. The thyroid hormone is stimulated by TSH. So TSH is made in the brain, stimulates let's try it again, your thyroid to function. Sorry, I misaimed there. ACTH, which actually makes cortisol, and that's kind of important for inflammation and things. Luteinizing hormone, which releases eggs and regulates testosterone. So both boys and girls use luteinizing hormone. And follicle stimulating hormone, which both boys and girls use because it either helps the eggs develop in the ovaries or the sperm to develop in the testes. This is a video that kind of reviews that. If you wish to watch it, it is a good one. The posterior pituitary, so the one behind, secretes these 2 hormones that you need to know, and that's oxytocin, okay, which contracts the uterus. We talked about that yesterday, and it stimulates milk ejection. We also have ADH, or vasopressin, and ADH literally stops you from having to go to the bathroom, and we will talk about this when we get to the urinary system again. As a result of stopping you from having to go to the bathroom, it increases blood pressure. And so that's one way we can regulate. If you notice that you're drinking a lot and you're working outside, but you don't have to go, it's because your ADH hormone is high. If you notice that you have to go all the time for whatever reason, your ADH hormones are low. Let's just talk about oxytocin really fast. I had a friend who was 8 months pregnant, 8.5 months pregnant, but it was her 3rd child. She was in Target, and a woman with a newborn came up next to her. The newborn started to cry. 2 things happened to my friend. My friend had a amount of oxytocin secreted from her brain. It caused her breasts to eject milk. Keep in mind, she's 8.5 months pregnant, so her top gets all wet. But worse, it caused her uterus to start to contract, and she had her baby a month early. So that's the thing with oxytocin, is when that hormone stimulated, it's going to have the effect. So your first pregnancy, you can be next to a crying baby. It's not going to have an effect on your brain. But once your body knows, oh, this means the baby's hungry, then it can cause those hormones to be triggered, even if you even if your body isn't quite ready yet, even if you're still pregnant at that time. So I thought that was kind of interesting. All right, moving on to your thyroid. Your thyroid, once again, is in your throat. It is butterfly shaped, okay? Your thyroid has thyroid stimulating hormone that is sent from the pituitary, and it secretes T3 and T4. So if you have hypothyroidism, you might be getting T4 or T3 or a combination of both of those. What is your thyroid for? It regulates your carbs and your lipids and your proteins. If you notice you're getting slow and constipated and you're not thinking well, then probably you have a thyroid issue. One thing that you need to do to protect this thyroid, because it's right here, it's very exposed, is when you go for your dental exams and they want to x-ray you, you always ask for that neck piece. And that neck piece is vital because, yes, it's just a little bit of extra x-ray that's being flashed to you once every other year. But over time, that can actually damage your thyroid. So you never, ever want to have an x-ray where you're not protecting your thyroid. I always ask for it, especially sometimes they have to dig it out and dust it off, but it's all okay. All right, so this is just a very short video that we're going to watch because it shows you where it is. Let me see if I can get this going fast enough.
Hello, my name is Dr. James Lee, and today I'd like to show you a little bit about the thyroid and where it's located. The thyroid is a butterfly-shaped gland that sits on top of the trachea or windpipe. It's made up of the right thyroid lobe as well as the left thyroid lobe, and they're connected by the isthmus or the centerpiece. Occasionally, there's a finger of tissue called the pyramidal lobe that extends towards the head. The thyroid creates thyroid hormone, which helps regulate your metabolism. There are a lot of important structures in the area, including the parathyroid glands. These are 4 small glands that sit behind the thyroid and control the calcium levels in the blood.
Okay, and this I want to show you. Ooh, sorry about that. This I definitely want to show you. This is the a thyroid. And so these are actually antagonists to your thyroid. So your thyroid makes calcitonin, which puts the calcium in your bones. And your parathyroid makes parathyroid hormone, which takes the calcium out of your bones. What kind of feedback system is that? You got it. It's a negative feedback system. Good job.
In addition, there's an important nerve called the recurrent laryngeal nerve that helps control the voice box. It's very important that your surgeon is familiar with this area. If all 4 of the parathyroid glands are injured or removed, the blood calcium levels may drop quite low, and you may need to take calcium and vitamin D pills. If the recurrent laryngeal nerve is injured, your voice may become hoarse on a temporary or permanent basis.
So I'm kind of done with the video, but what I wanted you to see there is sometimes when you do have to have the thyroid or parathyroid removed, they don't actually remove the whole thing. They'll simply remove the necessary parts. All right, here we are. So what can go wrong with your thyroid? Well, if you don't have enough iodine in your diet, you can get a goiter. And it's basically that your thyroid grows into a grapefruit size, slowly choking you while you sleep at night. It's also not very attractive. You can see this lady's is a little bit more hidden, but you can see that whole thyroid area right here. It is quite swollen. This lady's is not as hidden. It kind of looks like she's got a chicken in her neck, and her eyes are popping out. And that's one thing with hyperthyroidism. When your thyroid's working too hard, you get, I believe it's Graves' disease, and your eyes start to protrude from the head. If she were to have had her thyroid removed, this would go back and she wouldn't have that angry, startled look any longer. Where do you get iodine? You may notice most of your salt does contain iodine. Some people have allergies to it, so there is salt you can buy without iodine, but in general, I always look at my salt container and make sure there is iodine in there so that I don't have thyroid issues. Another thing is if you get radiation poisoning, they do try to take care of things like your thyroid, and one of the things that they'll give you is large amounts of iodine. Okay. This is actually was a gift from a student. Her sister had to have this removed because she couldn't breathe, and she was not very old. She was 17, but they had to remove her thyroid, and you can see it's not looking lovely at all. So she's fine. She's doing well, but she is on thyroid replacing hormones because obviously, and I was allowed to put her name up there. Obviously, it wasn't okay to keep this in, and she couldn't breathe. We talked about the parathyroid in the back of the butterfly, so right here. If you need to see that moving video, you can watch this again. But what it does is it takes calcium out of the bone. Well, why would you want to take calcium out of the bone? Who needs that calcium more than your bones? Better be saying it. Skeletal system? No. But connected. What are they? Yep, muscles and the nerves. Very good. The muscles and the nerves. Good job. It also can tell your kidneys and your intestine, hey, absorb more calcium. So you can get it out of the bone, and then at the same point, you can also say to your kidneys and your intestine, we need to absorb more calcium because we need it in the blood because our nerves and our muscles need that calcium in order to function. Here are the adrenal glands. I told you they look like 2 cute little hats. And where do you find them? Ooh, I hope you're not seeing what I'm seeing here, but they're right down there. They're right on top of your kidneys. There are 2 parts, the outer part, which is what you see, which is the cortex. And you know, if the outside is the cortex, the inside is the medulla. Remember how that's always made? Okay, the cortex is the glandular region and the medulla is the neural region. So they have different functions. And you can see here that they'll talk a little bit about the adrenaline. Let me see if I can play that for you quite quickly.
Hi, have you always wanted to learn to code but don't know where to start? Would you like to make
Endocrine glands. Adrenal glands. Adrenal glands. These are a pair of glands situated on the upper side of each kidney. Their secretion regulates the metabolism of minerals, carbohydrates, proteins, fats, and stimulates the development of secondary sexual character both in male and female.
So you may notice that, yes, it helps stimulate the breakdown of fat and carbs. And so it almost has like a digestive function in helping to regulate that. But it's very secondary. It also obviously helps you with your secondary sex characteristics.
The hormone adrenaline secreted from adrenal glands is termed as emergency hormone. In normal situation, these hormones are secreted in small amounts. But when a person faces stress or danger, adrenaline is secreted in large amounts to prepare the body to face emergency situation. These increase the rate of heartbeat to supply more oxygen to muscles. Also, blood supply to the digestive system and skin is reduced due to contraction of muscles around small arteries in these organs to direct more blood to our muscles. The breathing rate also increases due to the contraction of the diaphragm and rib muscles. All these responses together enable the animal body to be ready to deal with situation.
And I guess what's good about that is you realize it's not just your fight or flight, but any animal's fight or flight. That is the focus of the adrenaline and epinephrine. Epinephrine is the scientific name, and adrenaline, of course, is the more layman's term. So, hormones of the adrenal cortex, the outside, are glucocorticoids like cortisone and cortisol. And yes, they make you use more fat and sugar when the body needs energy. And mineral corticoids like aldosterone. And aldosterone helps you retain water and regulate your electrolytes. So aldosterone and ADH, these things all help regulate your blood pressure. What are the hormones of the adrenal cortex? Continued? Well, sex hormones. So they're androgens like testosterone and estrogen. So if you're a male, you need estrogen to open up your capillaries and help the nitrogen do its thing in popping open those capillaries. So where are you going to make your estrogen? Because you're not making estrogen in your testicles. Well, you're going to make them in your adrenal glands on the adrenal cortex. And if you're a female, you're not making testosterone in your ovaries. But without testosterone, you have no sex drive, your muscles are totally weak. So where are you going to make your testosterone? Well, you're going to make them in your adrenal cortex on your adrenal glands. Okay, so now let's talk about the medulla, the middle part. That's where your epinephrine and norepinephrine are made, and that's for short-term stress. And norepinephrine doesn't affect the heart as much as in like a dangerous way. Epinephrine can affect the heart because epinephrine also allows things to clot, and blood clots can cause heart attacks, which we talked about. Okay, moving on to the pancreas. In the pancreas, you have islet cells. This is where you'd find these islet cells in your pancreas. And this is where glucagon and insulin are made. So glucagon's made in the alpha cells and insulin is made in the beta cells. Unfortunately, as you can see here, these light cells in here are the beta cells. These are the ones that if you're diabetic, have either type 2 diabetes, maybe they're not producing enough, or you have receptor problems, but type 1 diabetes, they die. And unfortunately, we have no way of getting these cells back yet, although we are continually working on it. They're antagonist, which means that glucagon puts the glucose, the sugar, in the blood, and insulin takes it out of the blood and puts it in the cells. So insulin takes sugar and puts it in the cells, and glucagon will put it back in the bloodstream. And that's how you maintain homeostasis. I would definitely suggest watching this movie on diabetes. We can't watch it right now because it's too long, but diabetes is something that will definitely be on your test. So please do watch that. Maybe I'll put a quiz on there. Okay, so here's your islets of Langerhans, and you can see that you have the beta cells. Sorry, let's try it again. The alpha cells. No, I said it right. The beta cells and the alpha cells. So the beta cells are for glucose, and the alpha cells are for, oh my God, I'm so saying it wrong. The beta cells are for insulin to release the glucose into your cells, and the beta cells are for glucagon. So take a look here, and how are we going to remember that? It's in alphabetical order. So G comes before I in the alphabet, and A comes before B in the alphabet. So just do it in alphabetical order. Alpha goes with glucagon, beta goes with insulin. Okay. Is there anything here that I can explain to you very quickly? Here's your pancreas. It's full of these islets of Langerhans, and inside there, there's your beta cell, which makes insulin, and insulin goes into the bloodstream and lets the sugar into your cells. And I think that's all they're trying to show you here. Here they're showing you that the alpha cells with the glucagon are secreted, but they're not doing a great job showing you that that's going to drive sugar into your bloodstream. Okay. Back to the brain. We already talked about the pituitary, which is here, but now we're in the pineal gland, which is here. And you'll remember from the brain dissection, we looked at this. We literally took your cerebrum and your cerebellum, and we kind of pried it apart, and you could see the pineal gland right there. That's part of the third ventricle of the brain in that area, and it secretes melatonin. So if you're struggling right now to sleep and wake at the right time, some of the things you can do are limit screen time before you go to bed, because that blue light actually activates your pineal gland and makes you feel more awake. If you were to do something like read a book, not a virtual book, but an actual book, that light isn't shining back on you. And it can actually help your pineal gland say, ooh, I'm getting tired, and establish that sleep cycle. This talks about why we need sleep. Once again, when you sleep, that's when the cerebrospinal fluid floods the brain, cleans it, and you come back better and stronger. The thymus is, I guess we are going to talk about it. It is perhaps the most interesting organ we talk about. In a newborn, it is huge. It is one of the bigger organs of that chest cavity. In an adult, it's gone almost. So it is the magically shrinking organ. The older you get, the smaller it gets. And that's one reason that possibly COVID, percentage-wise, has not taken out as many children as it has old people, because the thymus is where your T cells are matured. And in someone of my age, that thymus is virtually gone. And certainly by the time you're 80, it's just a hunk of scar tissue. So you can't get those T cells to understand this is a new disease, do something, because it thinks it's already seen everything. It does produce thymosin, and that does help mature and train white blood cells. Okay. This is a really cool thing that normally I'd have my first period class do. I generally have girls that are not on birth control, because a lot of people are on birth control because they have different menstruation issues or for acne. There's a whole bunch of reasons they put you on birth control nowadays. But if you're not on birth control, you can literally lick a slide every morning. And about 10 days before your period, your slide will end up having these things that look like fern branches on it. And it's literally estrogen that crystallizes. And when it crystallizes, it makes a fern-shaped pattern. When that happens, you know that you're in your fertile period. And it's not just estrogen, it's the rest. It's a whole concoction of female hormones for when you ovulate, that peak. Normally, you basically see like dead mouth cells on the slide. But when you get this, then you know you're fertile. Now, once again, please do not use this as a method of birth control. It does not work. Women, when they orgasm, often release an egg. Women do not always release an egg at the right time. You can do things like shut sperm down and hold onto it until you do release an egg. And that's not a mental process. That's just what some women's bodies do. So you'll notice some people get pregnant relatively easily, and their systems are just incredibly good at coordinating efforts. So please don't ever use this as a way of going, ooh, birth control. No, it can help people who are, let's say, in their 40s and finally deciding to get pregnant. It can help them get a pregnancy window, but it's not good against getting pregnant. So what does estrogen do? Well, it's for secondary female sex characteristics. So you're talking all the curves and bumps here. It also causes their reproductive organs to mature. And estrogen is important in producing the placenta. And the placenta, so you've got your baby, you've got your uterus, but you've got to connect the two. And that placenta is the tissue that connects the two, so the baby can be fed and taken care of. All right. So where is most of your estrogen made? In the ovary. And these are those blisters that I was talking about that the ovary makes. And she'll make a few of these every month, but only one will mature. So this is the one that's really ready. You can see this one, like it didn't work at all. And this one was like a half-hearted effort. But this one, okay, there's one egg, one little dot floating in there somewhere. And once again, what will happen is as it gets big, eventually it will just pop. Okay, and that blister literally breaks open, and that fluid shoving out is what causes the egg to spew out and be caught by the fimbriae of the fallopian tube, and then it travels down the fallopian tube to the uterus. Okay, estrogen does help maintain pregnancy with progesterone. Remember, progesterone is the pregnancy hormone, and I want you to kind of keep those pieces together. And it also helps prep the breast to produce milk. So in those first few months of pregnancy, that estrogen's working very hard, and your boobs are going to be terribly uncomfortable because they're trying to finish that maturation process. Remember, your breasts are not done developing until you get pregnant, and then those mammary glands start to develop. Okay, so here is that pop blister I was talking about. This is the corpus luteum. And that corpus luteum will secrete progesterone for about 10 days. When this has its 10 days of sending signals, I think we're pregnant, I think we're pregnant, I think we're pregnant. After that, it stops sending signals. So this one has stopped sending signals 2 months ago, but who's counting? When it stops sending signals, that's when the inner lining of the endometrium of your uterus sheds off. So that's what causes the menstrual cycle. Otherwise, it would actually help the egg to implant and help in making the placenta. You can see here why clearly one ovary will shoot off an egg 1 month and the other ovary will do it the next, because this is just a ferocious amount of damage every single month. Okay, so we talked a little bit about positive and negative feedback systems with the menstrual cycle already, so I won't talk about it too much. But you'll remember it's a positive feedback system when you're making the egg, and it's a negative feedback system when you have secreted the egg and that progesterone is going back up to your brain and saying, okay, we did it. Androgens are male sex hormones. I wanted you to see that the difference between the androgens and estrogen are very, very little. when you look at the molecules, they're almost exactly the same. You can see that even molecules evolve, that there are slight changes over time, where in this case, instead of just having an organism that maybe is asexual, now you could have a male and a female because of a slight tweaking of hormones. Oh, and I did mention Mr. Mazzillo here because unfortunately, androgens or testosterone do affect hair, and they cause that hair to be created too fast, fall out too fast, and therefore men often have genetic balding issues. Oh, here we go. I do have a picture of how estrogen is different than testosterone. And notice testosterone doesn't have the hydrogen, estrogen does. We're right up here. Okay. Oh, and just in case you missed it, this is the parent hormone. So this comes and makes these two. Okay. So let's talk about the testicles. The testicles have interstitial cells, and you can see them here. These are the cells that are right. So this is a seminiferous tubule, and this is all to make sperm. And this is to make sperm, and this is to make sperm. But this tissue right in between here is the interstitial tissue, and that produces testosterone. And that's why your little spermy guys are all bathed in testosterone. It does not matter if you have a vasectomy, so if you cut the vas deferens here, because these hormones go through the bloodstream. They don't actually need the tube for the sperm, and you're not cutting off the bloodstream to your testicles. So the testosterone is still secreted at the same level. Vasectomies do not demasculinize you in any way. The only thing is you will be shooting blanks the rest of your life, but at some point in your life, you will find that a good thing. Okay, so testosterone is indeed responsible for adult male secondary sex characteristics like the low voice. Usually I get a man to speak, but I don't have one right now, and the humongous guns. That's all testosterone driven. And of course, it is required for sperm cell production. So people who've had testicular cancer and maybe lost a testicle, they're going to need to have testosterone shots so that they maintain their masculinity. Other hormones that produce testosterone that we don't really talk about are parts of the small intestine do, parts of the stomach, the kidney, the heart. We talked about the placenta. This is the placenta, by the way. Not very pretty, but that's okay. They all have endocrine functions. One thing that I do want to talk to you about with the placenta is when the baby's born, any good doctor will take the placenta, hold it up, and show you both sides. If they don't, please ask to. You need to make sure it looks as ugly as this one, nice and shiny all the way. If it has hunks missing, those hunks may still be in the mom, and they need to be removed, or she could hemorrhage and bleed out, and it could be very bad, life-threatening situation. So you do want to make sure that when the baby's born, you'll look at the placenta, both sides, and that it's okay. Okay. Some things that happen with the endocrine system, some things will shut down. So that ovary, after it's blistered and scarred for 30 years, 40 years, it finally says, please stop. And you go through menopause. And we did talk about that earlier this year, that menopause. What ends up happening is, yes, the brain sends the signal, please release the egg. And the ovary sends back the signal, I'm not going to do it. And then your brain sends out a bigger and bigger signal. And remember, it causes the pituitary to get so mad, it actually moves and causes friction, and it overheats. And so women get those hot and cold flashes. But eventually, the brain gives up and it says, I guess the ovary's really done. And you've gone through menopause. As a result, you're not secreting the estrogen as much as you were. You can take estrogen supplements for 1 year. If you take it longer than that, and that 1 year actually has some beneficial effects, but if you take it longer than that, your cancer rates go way up. So do not take estrogen for more than a year after you hit menopause. But as a result of not having the estrogen, your figure loses some of its curves because that secondary sex hormone is not there for you. And that's it. You guys did it. Excellent job. I'm going to just switch back to my face for you. So really good job. Proud of you. If you need a review, please watch these other videos that we didn't have a chance to do. And I'm going to try to get this going in a format that works for you. Please give me some feedback. Tell me how you like it. Thank you. Bye.